So a lot of these Fanconi anemia patients, they present with hyperinsulinemia or hyperglycemia. They have a much higher rate of diabetes. And so these endocrinopathies that arise in the Fanconi anemia patient, they really affect the patient's overall outcome to different therapies. So I'm interested in these new functions of the Fanconi anemia gene. So one of the things that we're going to do is we're going to look at, in pancreas cells, how these cells respond to glucose in terms of the Fanconi anemia proteins. So we're going to be doing expression profiling of these proteins in pancreas cells. Another part of the project, we're going to knock down, which will mimic Fanconi anemia mutations. We're going to knock down the Fanconi anemia genes, and we're going to look at the cellular response to glucose in terms of their insulin and somatostatin secretion profiles. And another aspect of the project is we are going to look for new functions of a couple of Fanconi anemia genes, specifically FANCD1 and FANCG. We're going to take pancreas islet cells prepped fresh from donor, and we are going to do proteomic studies to determine new protein-protein interactions that can be discovered for these Fanconi anemia proteins, which will hopefully open up the doors for more research into why these patients are more susceptible to diabetes and hyperglycemia. And this has a potential impact on the overall patient outcome, because things like hyperglycemia, hyperinsulinemia, they actually have a negative impact on patient overall survival, especially in regards to stem cell transplant therapy. There's an increased risk of septicemia and graft versus host disease in patients with these underlying conditions as well. So we hope to increase the overall patient survival and quality of life with these types of studies.